Hi, everyone, and thank you so much again for joining today, the PSYCKES Train the Trainer webinar. My name is Michelle Hand, and I'm a research scientist on the PSYCKES Medical Informatics team, and I'll be going over today's presentation. And I'm also joined by my colleague, Corin, who will help do some Q&A today for this webinar. So before I get started, I did want to point out first that all of the phone lines have been muted to help prevent any background noise, but you're still able to ask your questions during today's webinar by using that WebEx Q&A box, and that should be located to the right of your screen. Or if you're viewing this webinar in full screen mode, you'll just hover your mouse over the green bar at the top of the screen, and you can select this little drop-down arrow located on the far right, and then the Q&A option should be the first choice on your list. And just make sure to submit your questions to all panelists. And also, please don't use the chat function. We won't be monitoring that today, so just submit your questions in the Q&A box. And then lastly, we will be sending all of these slides out to all attendees after the webinar is over. So today's Train the Trainer webinar is really designed to teach people how to become trainers of the PSYCKES application at your own organization. So you'll want to get to know PSYCKES, and then you'll want to become what we call a super user, and then be able to train other people on how to use the application. So during today's webinar, we have some goals here. So our first goal is to identify some key considerations in planning for training, and then we want to review recommended pre-training activities. We'll also highlight some key information that we recommend for training or core competencies for your colleagues to know when using PSYCKES, which is kind of like a PSYCKES 101. And we'll also review training resources we have available that you can utilize for your own organization's training. And then I just want to note that today is not a thorough training of the PSYCKES application itself. So if you're brand new to PSYCKES, it might be a good idea to look into some of the other webinars we offer. For example, the Introduction to PSYCKES webinar is a good one to start off with, and that way you can really learn some more detailed information about PSYCKES before starting to train others. So let's dive into planning for PSYCKES training. So when you're thinking about scheduling or conducting your organization's PSYCKES training, you want to think about the following questions. So first, who needs training? Which staff at your agency will need access to PSYCKES and why? And then next, what do they need training on? So I've identified the staff who need access to PSYCKES, but what is each individual's use case? So there's a lot of different functionality types within PSYCKES depending on what type of work an individual is responsible for. And what type of training is most appropriate for staff? So what's the format of your training going to be? And then lastly, a really important thing is understanding the workflow at your organization. So what's the protocol that's going to be expected of your staff? And if you understand these things ahead of time, it can really help to inform your training. So then you're going to want to evaluate your training needs. So who at my organization needs access to PSYCKES? So different people have different roles in how they can use PSYCKES to help assist them in some of the work that we do. So this table here is to help you in thinking about these different roles and what their different use cases could be when it comes to using PSYCKES so that your training can be geared towards those individuals' needs. So here we have front desk staff. So this could be the receptionist or somebody in a similar staff position. And the use case for this role could be a few different things. So this person might be in charge of getting client consents when they first come through the door. And they might also be the person who's attesting in PSYCKES that consent was obtained. And front desk staff could also be the one to print out the clinical summary and put that in a client's physical or electronic chart so that the clinical staff can look at this information from within the chart. So the training domain we thought of here for front desk staff, if this was the use case an organization had, would be the registrar tab for those consents. And then next we have clinicians. So some other organizations might have the clinicians be the ones that look up clients' clinical summaries in order to assist with their clinical decision making or their treatment planning, or maybe those clinicians are the ones attesting in PSYCKES that consent was obtained. And some training domains for clinicians would be how to use recipient search to look up clients' individual clinical summaries, and they can even enable PHI access for clients using recipient search as well. And then next we have supervisors, and they might use PSYCKES to identify those high-risk clients, those high-risk cohorts of clients in recipient search. And PSYCKES might be helpful to supervisors also during their clinical supervisions. And this is also a great role type for monitoring PSYCKES use at your organization. So some of the training domains for this would be the QI reports for those high-need cohorts of clients. You could also do recipient search, and then we have clinical summary training, and then training on the usage reports. And the usage reports are used to help monitor the use of PSYCKES at your agency itself. So how many people have PSYCKES access? When's the last time they logged in? Or even how many clinical summaries have they been viewing? And then the last type of role we thought of was QA or QI staff. So these folks might review performance on quality measures, or they might integrate the clinical summary into utilization review or incident review. And some training domains here could be our quality indicator reports, recipient search, and the clinical summary. So next we have evaluating your training format. So seeing what would be the best way to train staff depending on the type of staff and also the resources that you have available to you. So listed here are just some ideas we thought of for your training format. And the very first one is, of course, our PSYCKES webinars, which you're on right now. We offer live webinars every month that staff can go to our website and register for, depending on what topic they want to learn more about. Or users can go to our website and listen to webinars that have been pre-recorded on our PSYCKES training webinars page. So this is really best for staff with computer access and those who are comfortable with computers, and also those self-directed learners. And the advantages of our webinars are that they're offered regularly and can be viewed in the live or recorded format. So if users join a live webinar, they can get their questions answered in real time. And for recorded webinars, users can watch that at times that are most convenient for them. Now the challenges here would be that these webinars are not specific to your agency's workflow, and they don't offer that on-site support for staff like you might be yourself as a trainer. Another training format we thought of is a group training demo. So you, the trainer, demonstrate how to use PSYCKES. And this is best really for a larger group of users. And also it's best if everyone in the room has a similar use case. So for example, if those who are attending are all the clinicians at your agency. And this is also beneficial for people who are already comfortable with computers. So an advantage of this type of training, the group training demo, is that you can tailor your training to how you want staff to use PSYCKES and to your agency's workflow. And then a challenge would be that it's difficult to assess if trainees are understanding the material since it would be a larger group, and of course scheduling is a challenge. Then we have group training, hands-on, and this is where you can really offer that immediate feedback and assistance. So for example, you can give trainees a skill to practice. And this is also best for larger groups with similar use cases. And a challenge would be if users are going into the application along with the trainer, a computer lab would be needed, and not every agency has access to one of those. And another challenge here would be that there could be users with different computer skill sets. And then lastly, scheduling, of course, could be a challenge. And then the last training we thought of was one-on-one training, and this is really good for people who need that extra support, especially with computer skills. And it also allows for some flexible scheduling, and you can provide that user-specific support. And then the challenge would just be how much time you have available to meet with people one-on-one. And it also really depends on how many people you have to train at a time. So next you'll want to prepare for the training session itself. So you've identified the people you want to train, what their use cases are going to be, and what your training format is going to be. So now to prepare for your training session, you'll want to develop your training outline and include some of those policies and procedures for how to use PSYCKES. So we have some examples that you can follow and adapt to fit your own organization. So for example, perhaps your policy will be that your agency will check PSYCKES for every Medicaid client that you see. And then another helpful tool that we have is the core competencies checklist, which is really a question and answer key. So can you do this PSYCKES core competency, and what's the answer? And you can find an example of this core competencies checklist on our Implementing PSYCKES page of our public website. So if you're going to do a demo, you'll want to decide if you want to use identified or de-identified data. So after you've logged into PSYCKES, you'll see in our upper right-hand corner that there's a toggle for de-identified, so that any client identifying information such as their name, their Medicaid ID, their date of birth, that will all become scrambled. So you'll still be looking at real people's information, but you're protecting their data by scrambling it. And then next, you'll want to practice skills to be taught. So if you're brand new to PSYCKES, you'll want to consider, of course, attending some of our webinars. And we have a few that we recommend attending or viewing. So the first one we thought of was Introduction to PSYCKES, which goes over each area of the PSYCKES application. And then the Using the PSYCKES Clinical Summary webinar. This goes into detail about the clinical summary and all of the information you can find in there. And then we have another webinar called the Consent Emergency Quality Flag PSYCKES Levels of Access webinar. And this is where you learn about the different ways a client's information can be accessed. And then we also have Navigating PSYCKES Recipient Search for Population Health. And this goes over all of the functionalities on the recipient search page and different filter options that this page offers. So a great idea is to make sure that users have had their tokens activated and that they've tested logging in prior to training. So for one example is if you're doing a group hands-on training, then the class won't be held up in case a user had trouble logging in or didn't test it prior to the meeting. And then another reason is after you've trained your staff, you'll want to make sure that they're actually able to go into PSYCKES and do those things that you've trained them on. And then finally, you'll want to have some training materials and contact numbers on hand so users have tools and resources to reference after the training's over in case they have any other questions. So here you can see on the left-hand side of the page, we have our Implementing PSYCKES page. And once you drill down, you can see that we have the PSYCKES Core Competencies checklist at the bottom and some training recommendations, a guide for that for staff at your agency to use. And then in that bottom left-hand corner, we have the implementation planning tool, which is also helpful along with our policies and procedures guide, which just could help you in planning your own trainings at your own organization. So here's an example of what that core competencies checklist looks like. So trainers could print this out and fold it in half lengthwise. And you can see in the left-hand column, we have a particular skill set, such as can you log in, can you search for a client, etc. And then the right-hand column is the answer key, so giving users the ability to check their work. So this could just be a useful outline to follow in your training. And then we also have a brief instructions for using PSYCKES in clinical settings. And this document can be found by going into our PSYCKES training materials page and scrolling down to the user guide section. And the brief instructions for using PSYCKES in clinical settings is step-by-step instructions on enabling PHI access, using recipient search, more information on the clinical summary, things like that. And then here's just a quick example of what that brief instructions document looks like in case you wanted to use it for your own agency's training. Okay, so before I get started into PSYCKES 101, I just wanted to take a quick pause here and check with Corin if we had any questions come in.
Hi, Michelle. We currently don't have any questions.
Okay, thanks, Corin. All right, so moving right along, we'll talk about PSYCKES 101. So it's important to teach your users about what the information and population is in PSYCKES. So let's just explain that for a moment. So PSYCKES takes Medicaid billing data and puts this into a user-friendly format. And when you're looking at an individual client, you can see up to 5 years worth of that Medicaid data, but only for the behavioral health population. So to be considered in the Medicaid behavioral health population, a client would need to have at least one of the following, which would be a mental health or substance use service, a mental health or substance use diagnosis, or any psychotropic medication billed to Medicaid. And then once they're in PSYCKES, this information that's available to the client in their clinical summary is up to 5 years worth of data, and that's across the treatment spectrum. So this includes things like medical, psychiatric, hospital ER information, substance use information if you have consent, and this is for clients who are on either fee-for-service or a managed care Medicaid. Now, when talking about the clinical summary, I just want to note that this section of the PSYCKES application is refreshed on a weekly basis. And then besides the clinical summary, something else that's available in PSYCKES are our quality measures or quality indicators. And these reference things like medication adherence, hospital utilization, general medical health, etc. And these quality indicators are in different sections of our application. So they're in My QI report, QI trends past year. We have them in our statewide reports, and they can also be filtered for in recipient search. So these flags are used to really identify clients who are at risk or in need of some sort of support or intervention. And it's good to teach staff a brief overview of where these quality flags are and where they can find additional information if they need it. And then additional information on these quality flags, just so you know, can be found on our website on our quality indicators page, or when you're in the PSYCKES application itself. So for example, in the clinical summary, in the quality flag section, there's a question mark icon that you can click on that will open up a box of definitions for each of our quality flags. And then the quality indicators are updated on a monthly basis. So another thing to talk about when teaching new users about PSYCKES is that there are some certain limitations regarding our data. So the first thing is that accuracy really depends on coding and billing. So if there was an error entered in on a bill, then that error would be reflected in PSYCKES until that was rectified. And then another point to make is that the data elements are limited to what is shown on claims. So for example, if you see in PSYCKES that a lab was done, you can see the date, the name of the test, the provider, but you can't see the results because that information isn't indicated in the billing data. And then next we have a point about our time lag. So there is a time lag between the time of the service happened and the time that service shows up in PSYCKES. And that lag really varies. And it depends on how quickly a provider bills and how quickly managed care companies get that information to the Department of Health. And then we get that data from the Department of Health every week. And then lastly, client data might be affected by hospitalizations, if those were bundled services, or maybe loss of Medicaid coverage, or if the client moves. Those are all things that can affect the data. So the takeaway message is that when you're talking about the data in PSYCKES, this can provide a lot of important information about a client's treatment history, but it might not be that full clinical picture. And another example of this is that we don't currently have Medicare data. So if a client is dual eligible and has both Medicaid and Medicare, only their Medicaid information will show in our application. So then lastly, when you're training staff, it's just helpful to think about appropriate ways to handle any inconsistencies between maybe what the client self-reports and what's listed in PSYCKES. And the goal should really be to support that dialogue. So another thing to consider when you're training is that there are different levels of access in which you can see client level data in the application. So here's a really helpful chart, it's a comparison chart on the types of access, whether that type includes data with special protections, and then the duration. So just to review this briefly, if a client has been billed for a service by your agency to Medicaid in the past 9 months, you can only see their name but no other clinical information. Now, if they have an active quality flag, you can see their clinical data but not specially protected data, which is referring to substance use HIV, family planning, and genetic testing. So as long as both the flag remains active and that they've been served by your organization within the past 9 months. Now, if you attest that a client is being served at or being transferred to your agency, but the client doesn't have a quality flag, you'll only be able to view their name. And then if the client does have a quality flag, again, you can view their data, but not that data with special protections, so long as the flag is active and up to 9 months after their last service. And then we have clinical emergency access, which grants access to all data, including that data with special protections, but that expires after 72 hours. And then lastly, we have obtaining consent. And this shows all data for up to 3 years from the last date of service billed to Medicaid. So that means if you continue to bill for them, the consent will continue to renew. Now, I do want to mention if you're a state level or managed care user, this chart doesn't apply to you. These user types will be able to see all data without consent because they have a different agreement for data sharing. So the training takeaway message for provider users is data with special protections is only available with consent or if there's a clinical emergency. So it's important that staff make an effort to obtain a client's signed consent rather than just utilizing the clinical emergency option, which I'll explain what that means in a bit. And it's really the right thing to do to get the client's consent, and also it just gives you access to their data for a longer period of time as well. And then for any managed care users, again, you don't need to see consent for this information. You'll be able to see data available for current and recent enrollees. And then we just have a quick visual chart for those managed care plan users, if any are on the line today. And this just shows the duration that you have access to all available data for current and recent enrollees. All right, so we'll go into PSYCKES core competencies, and then after that I'll stop for more questions if there are any. So the first core competency is logging into the application. So when you're teaching people how to log in, they're going to go to our homepage shown here, psyches.org, and they'll click Log into PSYCKES. Now, if you're going to encourage staff to save or bookmark PSYCKES in their internet browser, we recommend that you actually save the homepage you see here, psyches.org, which is showing versus the actual login page. If people save the actual login page, they usually run into some login errors or clear trust issues. So book the home page is what we recommend. So in order to log in, you'll need a token, and there are a couple different types of tokens. There's a hard token, which is that picture on the bottom right, and it looks like a keychain, or there's soft tokens, the mobile token at the top or a desktop token shown in the middle. And as of April this year, 2022, the default type of token, soft token assigned to you once you're granted access to PSYCKES in SMS is for mobile devices only. So desktop tokens are no longer being sent to new users, and tokens are no longer compatible for both desktops and mobile devices, and this is due to security reasons. So the token itself will provide a passcode, which is used to log into PSYCKES, and all users should have their own tokens. And then when first-time users log in, they'll have to set up a PIN. That means all those requirements listed on this page. So at the login page, the user will just enter their user ID and the passcode supplied to them by their tokens. So if it's the user's first time logging in, whether they're using a soft or hard token, they would just put in the numbers the token provided, and then they should be prompted on the next screen to create their PIN. And then for subsequent logins, that depends on what type of token the user has. So for hard tokens, the PIN is put into the passcode section, and then followed by the code generated from the token. And then for soft token users, they'll enter their PIN into the RSA app, which is shown right here, either the app on the phone or the desktop app. And they'll enter their PIN there and then tap the arrow, and then they'll type in or copy and paste the passcode onto the login screen. So if you get questions during or after your training, um, a lot of the times we see at the help desk that people are having authentication errors or maybe they don't remember their PIN. The OMH and ITS help desks are there to assist with any technical login issues. For provider users or non-state employees, you would use the you would contact the OMH help desk with that healthhelp@its.ny.gov email. And then for any state workers, you would contact the ITS help desk using that fixit@its.ny.gov email. And then we recommend emailing the help desks as we've noticed they tend to respond a bit quicker to users this way. And I'll also show this information at the end of the webinar as well. So the next core competency we have is how to look up a client. And the navigation links are at the top of the page. So if you want to go into PSYCKES and find an individual client, you will navigate to recipient search. And then in recipient search, the very first box along the top is recipient identifiers. So this is where you would go to conduct a search for a single client. And the best way to do this is using a unique identifier, such as their Medicaid ID or their Social Security number. But if you don't have either of those, you also can search for a client using their first name, their last name, and their date of birth. Using the name and date of birth could lead to more than one result, so you'll just want to teach your users to make sure that they confirm that they're looking at the correct client on the results page. And then the other thing that recipient search can do, as I mentioned before, is searching for a cohort or a group of clients. And by using various filters on this page, there's a lot to choose from. You can create a flexible and useful search for maybe projects your agency's involved in or data trends. And then for new PSYCKES users, I know the screen can look a little bit intimidating. There's a lot going on, but we have a separate webinar I mentioned earlier called Navigating PSYCKES Recipient Search for Population Health. That's not being offered live this quarter, but we do have a recording on our website, and then it'll be offered live next quarter. But that dives into a lot of detail on all of these different boxes and filters you see on this page. Okay, so when you run a search, you'll get back search results for anyone that meets the criteria that you've selected. And at the top of the page, you'll see a count of people who match. And below is the table that's de-identified for this presentation. So that's why it's all scrambled. But you would see their name, their Medicaid ID, date of birth, and gender. And then you'll also see whether or not that person has any active quality flags. And then their managed care plan. And then lastly, what level of access you have to that client's information. So when teaching people how to use recipient search, some people might say, I got 0 results. And there could be a few different reasons for this. So this could be maybe they entered in the client's Medicaid ID or Social Security number wrong, or the client might not yet be linked to your hospital or agency through billing, or manually through that PHI access module in PSYCKES. And then lastly, this could be because the client might be new to Medicaid and hasn't yet received a behavioral health service, diagnosis, or medication that was billed to Medicaid. And then for managed care users, this might be due to the client no longer being enrolled in your plan. So another core competency to potentially include in your training is the clinical summary. And at the top of the page, you can see we have different summary periods. What PSYCKES does is it defaults to the brief overview, but you can also expand that to the 1-year or 5-year view to show a bit more information. So if you have consent or clinical emergency access, you'll be able to see all available data, including that data with special protections. And if you don't have that access type, you just have quality flag level of access, then the message at the top right of the page would say that this does not contain all available clinical data, consent required. But as you can see here in the screenshot, we do have consent or clinical emergency access. So that means we have the ability to toggle between showing specially protected data or hiding it. So the heading is the client's demographic information. We have their name, their managed care plan name, their HARP status, things like that. And then underneath the demographic information is the current care coordination section. And this is what we call the who do you call section. And then we have another row for POP services, any active Medicaid restrictions the client might have, and then the alerts and incidents section. And then after that, we have the quality flag section. So if the client is positive for a quality flag, those flags would be listed here. And again, if you don't remember what a specific quality flag means, there is a quality flag definition icon at the top of the section, right here in blue. And you can click on that to see a list of all of our quality flags and their definitions. So on the next slide, I'm just going to show some examples of data with special protections. So in this particular example, in the behavioral health diagnoses section, we can see that this person has opioid, alcohol, and tobacco-related disorders. And under medical diagnoses, we can see that they also have HIV. So these are all examples of data with special protections. Now, if we were to toggle to hide up at the top of the page, these specific pieces of information would be scrubbed out, and you'd no longer be able to see them. Also, for clients who have a quality flag, not consent or clinical emergency, as I mentioned before, specially protected data wouldn't be seen, and instead you'd have this message showing at the top that this report does not contain clinical data with special protections, consent required. So we've already discussed the current care coordination a bit, but underneath we can see if there are any active Medicaid restrictions for that client. So in this section, you can see if there are any pharmacies or provider agencies that a client is restricted to for services. And then another thing you can teach trainees about in the clinical summary is we have a sections drop-down menu. So if you just want to see maybe hospitalization information, you can click on that little sections link and drop down to the hospital ER section, and it'll anchor you right to that spot on the page. Also, each section in the clinical summary can be viewed as a table or a graph. So depending on how you like to look at information, you can choose the way that that information is displayed. And if you'd like to see more details about a certain section, you can also click on See Details. So for example, if you want to see every single medication pickup rather than looking at the trial the client's been on for 2 years, you could click on See Details in the medication section to see just that. Now in the clinical summary, there's also something called the Integrated View of Services Over Time, or the IVOS graph. And this gives you a snapshot of what a client's service utilization has been or looks like for over a period of time. And each row represents a service that the client has engaged in. And then from left to right, you can see that time period. And in this instance, it's the past 5 years. And you can also look and see here what their medication utilization pattern is, maybe how often they're in the emergency room, what type of clinic services they've been to. And then what you can do is scroll down into the clinical summary and see more information like who that provider was, what were the dates of service, and maybe what diagnosis was given. So next in the clinical summary, you'll see the pharmacy data. And one section is for behavioral health medication and the other is for medical medication. So you'll just want to make sure to teach your users how this information is displayed, how to use this information, and then how to utilize that medication See Details button, which has an arrow pointing to it on the slide. So if we click that See Details option for someone who's been on gabapentin for several years, here you can see each trial they've been on as well as each pickup from the pharmacy. And you can also see who that prescriber was if that's on the claim and what pharmacy the client picked up their medication at. And then you can also view this information as a graph if you'd prefer, and you can do that by toggling on the top of that section from table to graph view. So there's also the hospital ER section, which is an integrated table of emergency room, inpatient, medical, psychiatric, and substance use information. So in this example we're looking at right now, there are some blank boxes, and there might be some data with special protections there, which is why we're unable to see it. We're allowed to see if they have had some sort of hospital service, but we don't know exactly what it was for. So this is where you could encourage your staff to obtain consent so that they can view the full details. And then here are some of the other sections available in the clinical summary. So you can see from this list that there's a ton of potentially valuable information that your trainees can get from the clinical summary, such as lab, dental, vision. We have living support and residential information, and then also transportation information. And then finally, the last functionality that I wanted to show you about the clinical summary is how to print it. So rather than going to your browser's toolbar and selecting print, we recommend that users export this to PDF. And the pages will just come out looking a bit cleaner, and this is something you'll want to share with your trainees, reminding them that they would need Adobe PDF on their computers to do so. So there's also some options to downloading to PDF, as you can see on this box showing on the screen. So you could either select a specific section or all sections, and then you can choose to print in portrait or landscape mode as well. Oops. Okay, so there might be a few questions about not being able to access a client's clinical summary, even though it was recently available. And this could be due to the client no longer meeting criteria for a quality flag. Maybe they had emergency access that expired. And then for managed care users, this could be due to the client disenrolling. And then another question that we've noticed comes up sometimes is, why can't I see lab results? And again, that's due to lab results not being included on those claims or encounter records. And then lastly, if someone's seeing no Medicaid claims available for this data type, we just recommend trying to expand the summary period, maybe to 5 years. Okay, so I just went over a bit of information, so I want to take another pause here and check in with Corin if any questions came in.
Hi, Michelle. No questions came in so far.
Okay, thanks, Corin. All right, so we'll move right into changing access levels in recipient search. So we're going to go back to recipient search and then utilize those recipient identifiers, that section, just to search for an individual client. So in that section, you can search using a client's Medicaid ID, their Social Security number, or their first name, last name, and date of birth. And then you also want to make sure you're searching the full database. So you want to check off full database in the search and buttons. And then here on the results page, you just want to confirm that you found the correct client. And then next, you'll see the current PHI access level. So in this case, we have no access. So to change this, you just click on the Enable Access link. And then before we go further, I just wanted to pause here to point out that it is extremely important that you confirm your search results, since there's protected health information for over 10 million individuals in PSYCKES, including that data with special protections. So it's really important to just double check that you found the right person on the results page by double checking their name, their age, their address, things like that. And also because you want to ensure that the right treatment decisions are being made on the right client information. Okay, so after we click Enable Access, there are a few options we're going to focus on for why are you allowed to view this data. So the first option is the client signed the PSYCKES consent form, and that gives you all available data, including that specially protected data, for 3 years after the last billed service. And then we have client signed a BHCC, or Behavioral Healthcare Collaborative Consent. So if you're part of a BHCC network and the client signs the BHCC consent, then the selected BHCC and your agency will be given access to all available data for 3 years. which renews automatically with billed services. And then next is the client signed the DOH 5055 Health Home Patient Information Sharing Consent. So if the client signs a DOH 5055, then users at your facility who work specifically in the health home or care management program will be given access to all available data while the client's enrolled. And then next we have attestation of clinical emergency, which gives you all available data, including specially protected data for 72 hours. And then the last option is the attestation of service. So the client is currently served by or being transferred to your agency. So this option allows you to access their clinical summary, but does not allow you to view that data with special protections. So if you need a reminder about what each of these options mean, you can also click on this blue arrow in the top right corner of the page, and that'll pop up a little box that'll show you more information on each consent option. So you can print the PSYCKES consent forms by selecting the blue question mark within the Enable Access pop-up box that's shown here, or you can go to the Registrar tab and click on the Manage PHI Access submenu. Now the consent form is available in both English and Spanish within the PSYCKES application. And another way to print it is actually by going to our public website and navigating to the About PSYCKES page. And there we have the consent form available in 10 languages. And then also it's best practice to have the consent form pre-printed and then available for clients as a hard copy. And then the original or scanned version of the consent could be retained in the client's medical record. And then lastly, agencies don't need to send the signed consent to our help desk or upload it into the PSYCKES application. It's just for your own records. So this is what the PSYCKES consent form looks like currently. And the client is to check either I give consent or I deny consent. And the consent is not valid unless this form is checked off appropriately and then signed by the client. So next you'll want to verify the client's identity. So you as the service provider can attest to the client's identity, or you could check off that the client provided one form of photo ID or two forms of non-photo ID. And then next you can enable and go directly to the client's clinical summary. You could also enable and quit and go back to recipient search. And then lastly, you can cancel and not enable. And then just a note, once you enable consent, any PSYCKES user at your agency will be able to view this client's data. So that's, again, why it's so important to just make sure you're looking at the right person. So there are also some questions that come up about what is an emergency and when can I attest that I know the client's identity. So here's just some answers to those common questions. So an emergency constitutes as a danger to self or others, has a sudden onset, presents an immediate need for treatment, and is driven by clinical criteria. And then for the second question, you can attest that you know the client's identity by developing some internal procedures or documenting the rationale, or maybe keeping a copy of the ID in the client's chart, and then being comfortable making clinical decisions based on the information that's provided to you. So the last core competency I just want to share with you is how to identify clients with quality flags. So you can do this by going to My QI Report and drilling down into a specific indicator of interest. And just to note, we do have a separate webinar using the PSYCKES My QI Report, which goes into a lot more detail about how to use this screen in the application. So we'll just touch on this today. But from here, you can drill down even further into a specific indicator. So let's pretend we drill into 2+ ER mental health. And then under the Recipients tab, you can see clients that are positive for that specific quality flag that you've drilled down into. So you could export this list of clients for clinical review, or you could even click on a client's name to drill down into their clinical summary and learn a bit more about how they meet criteria for that flag. So now I just want to touch on some resources that we have for you before stopping for any final questions that came in. So on our website, within the PSYCKES training materials page, we have our user guide section, which can assist you with how to log in, how to navigate to the clinical summary and what's in there, how to utilize recipient search and MyQI report, etc. There's a lot of different options to choose from. And then we also have our quality indicators page, and this is where you can find definitions and criteria for the quality measures run by us at PSYCKES. So this can be very helpful to look at if you're wondering why an individual is flagged for a specific quality indicator. And then lastly, we also have, again, our live and recorded webinars on our website on the PSYCKES Training Webinars page if you're interested in learning a bit more in-depth information about some of the other areas of our application that I touched on today. And then we did want to mention the self-service console. So the self-service console is a way to manage your RSA token and PIN for logging into secure applications, including PSYCKES. And you can do a lot of different things within the console. So you can set your security questions. If you ever forget your PIN or are having trouble logging in with your PIN, you can access the console with your preset security questions. You can go in there and reset your own PIN, which is really helpful. You can activate tokens in there, and then you can also request replacement tokens in the console. So we highly recommend that all users go ahead and log into the console and set up their security questions so that, again, if you ever need to reset your own PIN or if you're getting an authentication error, you can reset your own PIN yourself. And then as of April 2022, we just want to mention that the console must be used when new users need a token or existing users need a replacement token. And then lastly, we have our contact information. So we have the PSYCKES Help Desk. We're available 9 to 5, Monday through Friday, and we can assist with any PSYCKES-related questions, like how do I run this report, or seeing incorrect information. And then we also have the ITS Help Desk listed here. So they can really help with login, token, or SMS support questions. So for state employees, again, it would be the Fix-It email address you see here. And then for OMH provider partners, that would be the Health Help email you see on your screen. So before I end it here today, I just wanted to check in with Corin one more time to see if we had any final questions.
Hi, Michelle. We don't have any final questions at this time.
Okay, thanks, Corin. All right, everybody. Well, thank you so much for joining, and I hope everyone has a great rest of their day. Thank you.